Allen & Company wishes OOIDA and all members a safe, healthy, and joyous holiday season.
OOIDA, representing America's truckers since 1973, presents Landline Now with your host, Mark Reddick.
It's often easier and less expensive, painful, and time-consuming to do some very simple things to prevent an illness as opposed to treating it once you have it. That's a very timely thought right now. As fall moves into winter, the incidence of respiratory illnesses, things such as influenza, RSV, and COVID, rises considerably. The U.S. Department of Health and Human Services recognizes that and puts considerable effort into convincing people to take basic precautions against such illnesses. This year, that includes a program they're calling Risk Less, Do More. I recently discussed the program and the problems it's designed to prevent with Dr. Donald Dumford, the Medical Director of Infection Prevention at the Cleveland Clinic in Akron, Ohio. But first, the news with Scott Thompson.
Thanks, Mark. With weeks to go before the deadline for small businesses to report beneficial ownership information, a federal court has struck down the new requirement. The preliminary injunction prevents the Financial Crimes Enforcement Network from enforcing the Corporate Transparency Act, effectively killing beneficial ownership information reporting requirements that were due on January 1st. The federal government instituted the new requirements of small businesses to prevent financial crimes that are often committed through shell companies. Last week's ruling is a sweeping nationwide injunction that applies to all companies that were required to report beneficial ownership information. The federal government filed an immediate appeal in response. If the Court of Appeals rules in favor of the government, the injunction could be lifted and companies would be back on the hook to report beneficial ownership information. The number of people working in the trucking industry went up last month. The Bureau of Labor Statistics says nearly 3,000 trucking jobs were added to the economy in November. David Spencer, Vice President of Market Intelligence and Arrive Logistics, told Landline that higher-paying spot freight likely increased after 2 hurricanes, and strikes on the East Coast and Gulf Coast caused significant disruptions in October. Overall, Spencer said all signs are pointing to a healthier freight market moving forward. Accounting for all transportation sector jobs, employment rose by more than 3,000 jobs in November. Across all industries, employment increased by 227,000 jobs. The unemployment rate rose slightly to 4.2%. An appeals court has given the state of Rhode Island the green light to resume its controversial truck-only tolling program. It's the latest chapter in a long saga that began in 2016 when roadworks was signed into law. In mid-2018, the state began collecting tolls from commercial trucks and not passenger vehicles at more than a dozen locations throughout the state. Over the next 4 years, Rhode Island had collected about $100 million from the truck-only tolls. But in 2022, a judge said the tolls were unconstitutional and ordered them to end. An appellate court judge last week reversed that decision, setting the stage for a resumption of tolls. Rhode Island Governor Dan McKee called the ruling a victory for Rhode Island taxpayers. He said he plans to meet with state leaders soon to talk about starting the truck-only tolling program back up. The U.S. Department of Transportation has made it clear once again that testing for drugs through oral fluids is impossible right now. Last year, the DOT announced changes to its testing programs that would allow for the oral fluid testing. And while the new regulations went into effect in June, they haven't been put into motion because the U.S. Department of Health and Human Services has yet to certify any laboratories to conduct the testing. The DOT is also having trouble training specimen collectors. And now another problem. In a new notice of proposed rulemaking, the department announced interim provisions that require testing facilities to conduct urine tests in situations where oral fluid tests are currently required. The DOT said the proposed requirements are meant to be temporary and will end when the required number of laboratories are certified to conduct oral fluid drug testing. The number of Class 8 trucks ordered last month jumped considerably. ACT Research counted more than 37,000 orders in November, up 21% from October. Putting the numbers into perspective, ACT President and Senior Analyst Kenny Veith said orders were still 11% lower than a year earlier. He said the industry is still in the early stages of building through 2025 backlogs, but seasonally strong orders have made little progress in closing the gap. The Connecticut Department of Transportation is dedicating $31 million toward truck parking throughout the state. The focus will be on expanding parking at 5 rest areas. Work has already begun at the Middleton Rest area along northbound Interstate 91. The other sites getting a boost are in Madison, Southington, Southbury, and Vernon. The Connecticut DOT says there are currently about 420 truck parking spaces at public service plazas and rest areas in the state. The expansion project will bump that number up to about 600 spots. And finally, the generous spirit of OOIDA and its members was on display late last week in Kansas City, Missouri. The association extended its relationship with the Veterans Community Project on Friday through a $10,000 check and truckload of donations. The money was raised during OOIDA's Truckers for Troops campaign. The donations came by way of OOIDA employees. Both will go toward helping veterans who have fallen on hard times, including those who call the tiny home community their home right now. Chris Admire, the executive director of the VCP site in Kansas City, said the donations will go a long way.
Yeah, we were joking around. It's just kind of it seems like a normal December day when OOIDA shows up with a giant truck full of goods, and you know what it means to us as an organization. You know, one of the values that we put forth is, you know, operate confidently, knowing that the community has our back, and connecting the veterans to the community and the community back to the veterans to kind of create some normalcy in their lives again. And, you know, when you can count on somebody year over year to come and always be consistent, always give, it's good for us. It lets us operate confidently, and it lets us show to our veteran community to come in and utilize these services and come into our commissary day, utilize the food items that are in our commissary day that you guys help donate today. It gives confidence in them that if they're struggling towards the end of the month, they can always count on coming to VCP and making sure they can get through the month, especially in the holidays. You know, we're actually moving in this week. We moved in 3 new residents to our residential program. We're moving 2 more in, fairly confident we're moving 2 more in next week. And ironically enough, you guys brought 5 recliners in. So it's perfect timing.
The Veterans Community Project also has a presence in St. Louis, Sioux Falls, South Dakota, and Colorado. Next year, expansion cities include Glendale, Arizona, and Milwaukee, Wisconsin. That's Landline Now News for today. I'm Scott Thompson.
Thanks, Scott. OOIDA is seeking the names and addresses of military personnel serving overseas so we can send them care packages through Truckers for Troops. You can call that information in to Nikki Johnson at our main number, 816-229-5791, or email it to troops@ooida.com. Again, that's Nikki Johnson at 816-229-5791, or email troops@ooida.com. Starting Tuesday, Marty Ellis and OOIDA's tour truck, The Spirit of the American Trucker, will be at the Gaspers in Kingdom City, Missouri. That's located at exit 148 on Interstate 70. Stop in, say hi to Marty, and join OOIDA for a $10 discount. OOIDA is teaming up with Wreaths Across America to help honor U.S. military veterans. OOIDA will offer the chance to sponsor a wreath for $17. For each wreath sponsored, $5 goes towards the association's annual Truckers for Troops campaign, which benefits veteran organizations and sends care packages to active military personnel who are stationed overseas. We'll have a direct link to where you can sponsor a wreath at landlinenow.com. Those wreaths will be placed on December 14th. Next, I'll discuss respiratory illness season and what you can do to avoid getting one with Dr. Donald Dumford, the Medical Director of Infection Prevention at the Cleveland Clinic in Akron, Ohio. We'll be back in just a moment with more news and information. I'm Mark Reddick, and this is Landline Now.
Thanks for listening. Be sure to like and subscribe. If you want more content, go to landline.media to get updated news, information, and archived editions of our show. Once again, that's landline.media.
Penske owns and operates some of the best-maintained vehicles on the planet. Our used trucks come with a 5-year maintenance report and pre-sale inspection. So if you're in the market for a top-quality pre-owned truck, look no further. Search our inventory today at PenskeUsedTrucks.com.
Capital Reman, the leader in remanufactured diesel engines and components, has partnered with OOIDA to offer exclusive member benefits. Visit CapitalReman.com today to support America's transportation industry and take advantage of your benefits.
It's tested and proven. Burn 2.1% less fuel when you balance all wheel ends with Centromatic. Call 800-523-8473 to get the OOIDA discount.
The psychologist and author Ann Wilson Schaaf once said, "Good health is not something we can buy." And that is pretty much true, but good health is something we can achieve. You're listening to Landline Now, and I'm your host, Mark Reddig. Welcome back to the program. People are notoriously bad at doing things that prevent even the most easily avoided maladies. However, it's often easier and less expensive, painful, and time-consuming to do some very simple things, such as washing your hands instead. That's very timely now. As fall moves into winter, the incidence of respiratory illnesses, things such as influenza and COVID, rises considerably. Those illnesses hospitalize and even kill tens of thousands of people every year in the United States. People miss work. And for truckers who don't make money unless the wheels are rolling, that's especially bad. The U.S. Department of Health and Human Services recognizes that and puts considerable effort into convincing people to take basic precautions against such illnesses. This year, that includes a program they're calling Risk Less, Do More. I recently discussed that program and the problems it's designed to prevent with Dr. Donald Dumford of the Cleveland Clinic in Akron, Ohio. The Department of Health and Human Services has set up a program called Risk Less, Do More. It's something that involves what the agency calls a pan-respiratory virus. And, because we're dealing here with a general audience here, truck drivers who listen to our show, I'm not familiar with all these terms. I'm sure a lot of them are not. What do we mean by the term pan-respiratory virus?
Yeah. So the pan-respiratory virus thought is really just the ability to talk about all the different viruses out there during respiratory season that people are going to be at risk for kind of all in one fell swoop. As we get into December, January, February, that's when we're going to see a rise in a lot of our different respiratory viruses that are going to affect people. But this says, if we can just kind of lump them all together and say, hey, a lot of the risks are the same, a lot of the things you can do to protect yourself are the same, kind of makes things easier. And when we talk about these viruses, I usually like to kind of highlight the big three, which are flu, COVID, and RSV, because, there's a lot of other viruses out there that we don't talk about a lot, but it's probably because they cause less severe illness. But when we're talking about the things that are going to end up, having people miss work, having people end up in the hospital, some people even dying from these, those are the big three: flu, COVID, and RSV.
Now, let's talk about this campaign that's going on right now. Broadly speaking, what's involved in the program?
Yeah, essentially, it's just really getting the word out and trying to engage different communities with getting information and reliable information on vaccines. What they entail, what they're used for, who's eligible for them, where they can get them.
Okay. Now, before we talked today, of course, I was communicating with some of the folks there, and in one of the emails, they said that they thought reaching truckers might be a good audience. So I'm curious, why truckers in particular? What about that audience makes it a particularly good one to talk to about this?
Yeah. Well, when I was kind of thinking about this discussion today, I kind of thought about that question too. And I have both a very selfish answer to that, and I also have an unselfish answer to that. So, I was sitting there yesterday morning thinking about this, and I kind of looked at the stuff I was getting ready for breakfast, and I'm like, oh, my oatmeal's from Oregon, my coffee was roasted in Washington, my blueberries are from California. I drove to work in a car that was manufactured in Indiana, and then I know that the camera we're using for this, the speakers we're using, were probably made in another country. got to a port, somewhere in the United States, how they all get to Ohio where I'm at, that was via truck. So, on a selfish level, I need healthy truckers so I can get through my day. And I think when we think about it from more an unselfish, kind of stance, I think truck drivers are, just probably based on my selfish answer, kind of part of the lifeblood of the country. We can't really do anything with our day unless we're getting the stuff we need. And I think if you think about it too, from the standpoint of the truck driver, it's people who like to work, who need to be at work, and also the fact that we know that truck drivers as a community have some health challenges. One is the fact that the job entails, being on the road a lot of the time, which means that you might not have a reliable physician or other provider to be able to engage with in a timely fashion. We know that truck drivers, at least like if you look at the studies, are probably twice as likely as the general population to not be able to get the care they need. Because of that factor. Truck drivers are more likely to be uninsured, which is a big barrier to healthcare, and is also, when you do get sick, a huge problem financially. And then the other thing is, if you look at just chronic health conditions in truck drivers, which probably goes along with being in a cab for long periods of time, having a very erratic sleep schedule, and also there's some other health risks that we know are in that population. There is higher rates of the things that make you more likely to get bad outcomes from respiratory viruses. Truck drivers have twice the level of diabetes as the general population. They're more likely to be heavier and obese, which is a risk factor when we talk about, getting hospitalized for flu, COVID, and RSV. They have higher rates of COPD because we know that you're around truck fumes a lot, and that can damage the lungs. That's all things that kind of raise the risk for these viruses and getting really sick from these viruses. So what can we do to help mitigate those risks? And the way to do that is getting the appropriate vaccines when you need them.
I do remember before COVID, there was a lot of talk about the fact that truckers traveled so many places meant that they were more likely, in some cases, to pick up some of these things because they were interacting with different populations. But when COVID came along, they kind of discovered that in some ways the opposite is true. They were less susceptible to that because they're isolated in that truck for so much of their day. Is there any thought in particular as to which one of these, now that we have these experiences behind us, is more likely the case?
Yeah, well, I mean, I think I'd probably say that, I didn't see particularly like if there is a different incidence of these viruses in truckers. So like, if you look at, is a trucker more likely or less likely to get COVID than somebody else, who does a different job? I didn't see that there were differences in the actual like likelihood of infection. I think probably the fact that, even if you're in that truck for a long period of time, which is probably protective because you're not actually getting exposed to anybody, still when you get to your pickup spot, your drop off spot, when you're stopping to gas up, you're stopping at that truck stop for dinner, you're still interacting with the public and people that could be carrying things. So the risk is still there, even if there's long periods of time where you're not interacting with people.
I want to jump into some of these illnesses here that you mentioned earlier. And I think by now most of our listeners are familiar with COVID and certainly the flu. But some of them may not have heard of RSV. And in fact, I only learned about this a few years ago. And suddenly my doctor's having me vaccinated for RSV, which wasn't part of my routine before. What is RSV and how dangerous is it for someone who gets it?
Yeah. So the full name for RSV is respiratory syncytial virus. So that's why we call it RSV, because that's a whole mouthful. This is for a long time, predominantly the concerns were in the pediatric community. And really what happens with this virus is you get exposed, you get infected, it initially kind of looks like everything else. You may get a fever. It's not as likely as with flu and COVID. You're going to have your stuffy nose. You're going to have a cough. You could have a sore throat. You're far less likely to get like the muscle aches and joint pains you get with flu and COVID. But as the virus progresses, and after it causes that bronchitis, that top layer of the lining of the airways kind of sloughs off. And it's because it starts to cause those to die. So when that sloughs off, it actually can cause some blockages in the small airways down deep in the lungs. Now, for the average population, most people are healthy, and between the ages of we'll say 6 and 64, RSV isn't that big of a concern. It might cause a couple people to miss work. But you're probably not going to end up in the hospital with it. Now, if we talk about, our initial priority population, young kids, when you've got these little tiny airways and you have things that all this kind of sloughing off the cells and stuff, that's going to cause those blockages. And we know that, the risk of hospitalization is insanely high in young children and infants. Now, I think the population where we're seeing, that we're realizing more and more has a high risk is those over the age of 65. And then those also who are a little older and also have health problems, diabetes, obesity, COPD, heart disease, weakened immune system. Those are all going to be risk factors for ending up in the hospital. And the rates of hospitalization and death for those over the age of 65, and especially those with those health problems, is much higher. Like we're talking like 20, 30, 40 times the rate of somebody like me who's 44 ending up in the hospital with RSV.
Prevention is a lot of what we talk about when we talk on our program about these illnesses. And before we get into some of the other parts of that particular topic, I'd like to kind of talk about the elephant in the room. We probably at this point all know someone who is skeptical of vaccines or who just basically won't get one. And at this point, all of these vaccines are voluntary. What would you say to people who are not sure about getting a vaccination?
Yeah. So, I have a lot of these discussions in the office with some of my patients because, there's some rumors out there. There's some valid concerns out there with vaccines. And I tried to, as we were kind of going through COVID and just thinking about everything, I kind of approach things with an open mind and I say, okay, what's the data say? What are those risks? And then I also always, whether it's vaccines or it's just, regular care of patients, when I'm dealing with people, I try to approach things by thinking about what I would do for myself or a family member, and then kind of pass that along to them. So when I talk with people about vaccines, and especially like say the 3 vaccines we're talking about, I think the first thing is that people kind of think, especially for like the flu, and that's not that big a deal. It's been around for a long time. It's like, oh, most people are just going to get sick and be better in a few days. But if you look at it from the standpoint of saying, well, there's probably, every year, hundreds of thousands of people that get hospitalized with the flu. We expect for an average flu season about 40,000 people to pass away from it. That's a risk. And I say, that vaccine's been around for a long time. We see very few side effects. If you get vaccinated, you are going to cut down on your risk of acquisition of the virus. If you still end up getting the virus, but despite being vaccinated, it's going to be much less severe. And especially for those people with those health problems we talked about, it's gonna have the chance of keeping you out of the hospital.
That was Dr. Donald Dumford, the Medical Director of Infection Prevention at the Cleveland Clinic in Akron, Ohio, talking about respiratory illness season. We'll be back in just a moment with more of that conversation. I'm Mark Reddick, and this is Landline Now.
Running on ultra-low sulfur diesel? Stay protected this winter with Howe's Diesel Treat and Diesel Lifeline. Steer clear of gel and ice with North America's #1 trusted brand. Find Howe's products nationwide at select retailers, auto parts stores, truck stops, and on Amazon.com.
When it's time to overhaul your truck engine, help protect it by insisting on a genuine Vibratech TVD crankshaft damper. Heavy duty, absolute premium quality, and they're made right here in the USA. Find a dealer at VibratechTVD.com.
Truckdown.com. Whenever you have a breakdown, you need Truckdown.com. 24/7 access to 40,000 verified heavy-duty repair vendors nationwide.
Truck revived. Deliveries thrive.
Truckdown.com.
Landline Now, welcome back. Before the break, I was talking with Dr. Donald Dumford, the medical director of infection prevention at the Cleveland Clinic in Akron, Ohio. And our topic is respiratory illness season, as well as the Department of Health and Human Services effort to raise public awareness of how to prevent those illnesses. We had discussed the information campaign by Health and Human Services, why the department wanted to reach out to people in the trucking industry specifically, and the particular health problems faced by truck drivers. We also covered RSV, a respiratory illness many people may not be aware of, and the concerns some people have concerning vaccinations and how he responds to those concerns. We now continue that conversation in progress.
Now, I also like to kind of phrase it as well as saying, you also can't just think about kind of yourself when you're thinking about getting a vaccine. You've got to think about your family that you live with, your family that you interact with, your friends that you interact with. And sometimes you've got to roll up your sleeve and get the vaccine to protect them. So, because it might not be that bad in you, but if you can prevent you from getting the virus, passing along to a elderly family member who has heart disease, lung disease, you might prevent them from ending up in the hospital. So that's kind of the first way I approach it. And then, the second way is just kind of, asking, what are those concerns that you have? And then trying to just educate about the safety and everything. I think that the thing that comes up most often these days is with the COVID vaccine, and especially the risk of the heart inflammation with it, which we have seen in a small number of people, and particularly it tends to be in kind of teenage males it seems to be the most common population. But if you really look at the numbers and you look at what's the likelihood of getting myocarditis from the vaccine versus what's the likelihood of getting myocarditis from the virus itself, the risk of getting myocarditis from the virus itself far exceeds the risk of getting it from the vaccine. So even those risks that we worry about with say, the COVID vaccine, in fact, it's probably more mitigating the chance of those happening if you actually get the virus itself. And so I think that's the other thing. And then the other thing, too, is, a lot of people worry about long COVID right now. And we know that the COVID vaccine does reduce the risk of long COVID. And, it's unfortunate we're seeing some people out there with 6 months of symptoms after they get COVID. And that's something else that's going to mitigate that. So sorry, that was a long-winded answer to a short question.
That's okay. As sometimes you need to talk a while to get all the information out.
Yeah.
I want to get into kind of the everyday stuff in terms of prevention. And there are things that are important to do or to avoid doing in order to keep yourself from being exposed or getting one of these viruses. Mm-hmm. And I want to kind of take these illnesses one at a time and start with RSV. As I mentioned earlier, probably the one that people know the least about. And you mentioned younger people. And of course, when I first heard about this, it was daycares, it was elementary schools, and people were at daycare would sanitize all the toys every day, trying to prevent this thing from getting around. But I had to have an RSV vaccination because I'm over 60 now. I'm diabetic. Mm-hmm. Looking at this from a trucker's point of view, what are some of the everyday things they can do to prevent getting this illness?
Yeah. And I think probably when you think about kind of prevention, I'd kind of lump all three together because you're gonna, what you're going to do for one, you're probably going to do for the others. And, when you look at them, COVID is almost entirely respiratory acquisition. There's probably a very small amount of get it on your hands, then get it to your face to cause infection. The flu is mostly respiratory with a little bit more contact than COVID. And then RSV has the potential for both. And I think so the first thing first for all of these is going to be good hand hygiene. So make sure, when you're interacting with people, like let's say you're stopping to get get your lunch and taking a break from driving. The first thing you want to do before you sit down and order and have your food is make sure you washed your hands. I think the hand hygiene we know for every respiratory virus does cut down on the likelihood of acquisition. I think the other thing you can do for protection is keep a bottle of hand sanitizer in your cab, just so you've got that handy to make sure you're keeping as clean as possible. And I think the other thing too would be, just if you're going to be very, protective, is even keep some sanitizing wipes, wipe down the wheel, wipe down the dash, just so you've got a clean surface. I think otherwise, I always like to also just promote, what we can do for ourselves, just general health wise. People oftentimes will ask me, what's the magic bullet for strengthening my immune system for respiratory virus season? They're like, oh, should I take this vitamin? Should I take that vitamin? Should I eat these foods? It essentially boils down to get good sleep, keep a pretty good balanced diet, stay well hydrated, and try to cut down on your stress level as much as possible. So that's going to kind of set up shop for you being able to fight off viruses during the season. And then, of course, vaccines, like we talked about. And I think the other thing, too, is, when viruses are spiking, which we're going to start to see as we get into, mid-December, early to mid-January, pretty much all three of these we're going to start to see a rise in. When we do see those cases spiking, consider putting on a mask when you're interacting with people. I know a lot of people don't like to hear that, but we know that even just the plain surgical mask or medical mask that you can buy a box of, those cut down on your risk of acquisition by about 40%. So my personal, and then I was kind of, when I talk about this, I say kind of what my personal practice is when I talk about masks. Initially early on in the pandemic, I was wearing masks everywhere. Now I pretty much limit it to say, if I'm going to be traveling, if like I'm hopping on a plane and going someplace, that's when I wear a mask, just because I know there's probably people there who might be sick because they paid a lot of money to be someplace. Sometimes as it gets like if cases are really spiking, I might wear it to the grocery store or church, just because there's going to be a lot of people congregate all in one spot. So I think it's just really, when we're talking about masks, kind of looking at what the local transmission is, look at your health problems, or health concerns, and then kind of just your risk stratification.
I want to follow up on some of the things you said there. One thing early on in that answer, you mentioned respiratory acquisition, and I think I'm on to what you're talking about there, but just for the layman, what does that term mean kind of in everyday people talk?
Oh, sure. Yeah, that's pretty much means that I breathe out, cough, or sneeze and shoot some virus into the air, and then somebody else breathes it in. So, yeah. And that's for all three of these, for all the respiratory virus, and for the big three, they all have where you cough or sneeze out or even talk out little water droplets that are microscopic, that are laden with virus, and then those are kind of floating in the air. Somebody else breathes in, and then they get into their system. So
something else, talking about kind of the hygiene angle of this, and the big one that we all hear about, of course, is washing hands. And I talked with a friend of mine who's a nurse a while back, and he was talking about during the COVID era that people have this idea of washing their hands on a regular basis as, a little bit of water, a little bit of soap, wash the soap up, I'm out. Mm-hmm. And of course, that's not really washing your hands. When we're talking about during this respiratory virus season, give us an idea of what people really need to do to wash their hands to prevent this from spreading that way.
Oh, sure. Yeah. Well, I will. This is going to sound silly, but I'm going to tell you what I tell my 5-year-old daughter. Because we kind of make it easy for kids because we say, hey, make sure you get soap on your hands, warm water, and then sing Twinkle, Twinkle, Little Star. And if you sing Twinkle, Twinkle, Little Star, that's 20 seconds of scrubbing. And that's what you should be doing to wash your hands. So it's not the quick, I'm done. It's, scrub, go all the way through, get the backs of the hands. You can also kind of scrub the nails like that because we know that bacteria and viruses like to hang out right at the nails. And really, that's the best guideline is sing Twinkle Twinkle Little Star and scrub during that entire time, and you're good to go with that.
Or maybe some other song about the same length.
Yes, exactly.
If you feel silly singing that to yourself. I just have this image of some truck driver going into the bathroom and singing that, and the other people like, what?
Yeah, I think that sounds like a great campaign. Though let's do the trucker Twinkle Twinkle Little Star campaign. We get everybody good hand washing. So
there you go.
But yeah, any song that takes 20 seconds, sing or hum the refrain for your favorite song, and that'll probably be it. So or count to 20. So
there you go.
Yeah.
Something else you mentioned there is that masks cut your risk by about 40%. And that's one of the things that always strikes me is people seem to look for the magic bullet. They seem to be looking for the one thing they can do that's just going to fix this. Isn't it really a matter of just a number of things, each of which cuts your odds a little bit, but when you combine them, they cut your odds a lot?
Exactly. Yeah, and that's the way to think about it. And really, it's like you take all these things that cut down on your risk some, and you put yourself in the best possible position to not get sick. The 100% thing would be, in October, go into your house and stay there till April. And I don't think anybody can actually do that. So, but that's if you do that and you don't actually see anybody, then that's going to cut down your risk to zero. But I think otherwise it is taking all these different practices and putting them together to give yourself the highest likelihood of getting through respiratory virus season unscathed. It's like if you take mask cuts down 40%, wash your hands cuts down, I think probably about 50%, but that's only compared to people that don't wash their hands. The vaccine cuts down your risk for acquisition of the virus by 40 to 50%. You put all those together, and you probably went from your likelihood dropping by about 80 to 85%. So, and that's sort of the way to think about it is take all the different things you can do and put them together and set yourself up as best as possible for the season.
I've been talking with Dr. Donald Dumford, the Medical Director of Infection Prevention at the Cleveland Clinic in Akron, Ohio. And our topic is respiratory illness season, as well as the Department of Health and Human Services' effort to raise public awareness of how to prevent those illnesses. After a short break, we'll be back with more of that conversation. That includes a discussion of how to find lower cost or free vaccinations for people who are uninsured or underinsured, what the respiratory illness season looks like so far in terms of how many people are getting RSV, COVID, and influenza, and how many people may be hospitalized or even die from contracting one of the three main respiratory illnesses. We also covered what sorts of things you can do for your general health that can help reduce the effect of these and other illnesses. Meanwhile, after our conversation with Dr. Dumford concludes, we'll list off where you can find more information online about the Department of Health and Human Services Risk Less, Do More awareness campaign, as well as some other helpful resources. We'll be back in a moment. I'm Mark Reddick, and this is Landline Now.
Are you tired of the IRS following you around like a dark cloud? Call 888-557-4020 and get your life back.
At Truck Stop, we built a better load board for carriers like you. Sign up today and access over 600,000 loads on the most trusted online load board. Learn why the best in the business rely on Truck Stop to make more money and start driving your profit today.
Since you started, what you've loved about trucking is the freedom. Heading out on your favorite route, a good driving song, and thinking about truck insurance. Well, maybe not that last one. That's why we're here. At OOIDA, we have a full range of truck insurance products, expert advice, and great customer service, helping you get the right coverage for your operation. Go to OOIDA.com, because your job is to drive. Our job is to help with everything else.
Landline Now, welcome back. Before the break, I was talking with Dr. Donald Dumford, the Medical Director of Infection Prevention at the Cleveland Clinic in Akron, Ohio. And our topic is respiratory illness season, as well as the Department of Health and Human Services effort to raise public awareness of how to prevent those illnesses. Before the break, we discussed concerns about unvaccinated people passing on respiratory illnesses to friends, family, and other people they encounter, the concerns people have about getting vaccinations, and the possible side effects some people do experience from vaccinations, and how that risk compares with getting one of the respiratory illnesses. We also talked about everyday actions people can take to prevent getting one of those illnesses in the first place, how people should wash their hands in order to actually prevent illness transmission, and how using several different prevention techniques can cut your risk for catching something even more. We now continue our conversation with Dr. Dumford in progress. A lot of us who received COVID vaccinations during the pandemic, in fact, I think most of us, those were free. That was nice. But of course, now the free vaccination era has kind of come to an end. Is there a place where people who, say, don't have medical insurance, and as you mentioned, a lot of truckers do not, or people who are underinsured can get financial help or get a free vaccination?
Mm-hmm. Yeah, the best place to start with, I think the best resource for this is really your local public health department. Every county has a health department. Every big city has a health department. If there's a trucker out there that says, "Oh, I haven't gotten vaccinated yet," but is looking to, I would start with those places. Like, let's say you're maybe not at home, but you're traveling somewhere. Call that local county health department and just say, "Hey, is there an option for getting vaccinated?" And oftentimes counties will have free vaccines for the population.
Okay. And one last question. As you mentioned, we're about ready to head into the real heavy season for this. What has I usually ask, what has flu season been like so far? But I guess now it's, what does respiratory illness season look like so far? Is this a particularly bad year? Is it a little bit lighter? What are we looking at?
Mm-hmm. So I think, I'll first say that we won't know until it's over how bad it was. But there's a couple of things we can look at with, deciding how bad it is. I mean, obviously, when you think about COVID, we are far away from 2020 and 2021 when things were terrible. If you look at our hospital, we are a 400-bed hospital, and a third of those beds were taken up with COVID patients at the height of the pandemic, which is just crazy to think that, one thing can take up that much of our resources. But now, we don't have as severe cases these days because of vaccines, because of people getting exposed. But when you look at how to say how bad it's going to be, I think my best prognostication right now is going to sound really boring, and I'm going to say it's probably going to be an average season. But we have to keep in mind that an average season still means that, between these three viruses, there's probably going to be about almost 1 million people hospitalized, and we're probably looking at 200, well, I'd say probably like 100,000 deaths, for an average season. Like you could probably say each year, flu causes about 40,000 deaths. COVID, probably about the same, based on what we saw the past couple of years. And then RSV itself is usually about 5 to 10,000 deaths, and those are of the age of 65. So in saying that it's probably going to be an average season still means that there's going to be a lot of people affected. But I think right now, with what we're seeing with the early number of cases and the early rise, it looks like it's smack dab in the middle of where we usually are. And then we look oftentimes at the Southern Hemisphere because they have their flu season over our summer, and they had a very average flu season. So I think we're going to sort of be right where we normally are with our numbers.
Okay. Is there anything else that you want to add, or anything that I missed that you think I should have asked about?
Yeah, I mean, I always just like to kind of reiterate, the things we can do just for, general health to increase our immune system is that good sleep, good nutrition, things like that. I like to also remind people that when you are sick, that is definitely the time that you should be masking, and that's more to protect those around you. If you don't have a mask on, you can use your elbow to cough into. I think that helps to mitigate. But I think really just kind of, we all have to take care of each other as a country. So I think this is the time where we can work on taking care of each other by, taking care of ourselves when we're sick, protecting others when we're sick, and then trying to prevent those infections to begin with.
Excellent. Doctor, thank you very much for your time.
You're welcome. Thanks a lot for having me, Mark.
I've been talking with Dr. Donald Dumford, the Medical Director of Infection Prevention at the Cleveland Clinic in Akron, Ohio. And our topic has been respiratory illness season, as well as the Department of Health and Human Services' effort to raise public awareness of how to prevent those illnesses. As I mentioned earlier, we do have some online resources where you can get more information about the Health and Human Services Risk Less, Do More awareness campaign, as well as some other helpful resources. First, we will have links to the announcement from the department about that program, as well as a link to the program's resource page. Then we'll have a link to the government's vaccine website where you can enter your zip code to find nearby locations that offer vaccinations, as well as the contact information for those outlets. Some of those locations will offer some vaccinations for free depending on qualifications. Call ahead to find out. People on Medicare can also frequently get vaccinations covered by that insurance, and people who have a good RX card can get 40% off the cost of some vaccinations. That card is available for free and can be ordered online. Also, most local health departments will provide free flu shots. We'll have a link to the website for the National Association of City and County Health Officials, where you can look up those local health departments anywhere in the U.S. We'll have all that information on our website, landlinenow.com. Just click on the headline or the photo at the top of the page and scroll down. That's where you can find all the website links, email addresses, and phone numbers we mention on that day's show. Again, that's at our website, landlinenow.com. For Landline Now, I'm Mark Rettig. If you want to make your voice heard on any of the issues we discuss here on the show, we urge you to call your representative in the U.S. House and both of your U.S. senators. To call any member of Congress in either chamber, all you have to do is dial the U.S. Capitol switchboard at 202-224-3121. Provide the operator your zip code, and they can connect you directly to the office of your senators and your U.S. congressman. Again, that phone number is 202-224-3121. You can also make contact with those lawmakers by using the website fightingfortruckers.com. At that website, go to the button that says Contact Your Representatives. On the right side of that page, you can write an email and send it to the people who represent you in the House and Senate. Meanwhile, if you want to contact your state officials about an issue closer to home, you can get contact information for those lawmakers through that same website, fightingfortruckers.com. Again, go to the link that says Contact Your Representatives, then scroll down to the bottom of the page and enter your zip code and click Continue. That will bring up a list of your elected representatives at the federal and state level with links to their contact information. And of course, you can always get contact information by calling the membership department here at OOIDA. Just dial 816-229-5791 during business hours, and they'll look the information up for you. Again, that's 816-229-5791. 5791. And if you're not able to write that information down right now, you can always find it on our website, landlinenow.com. Just click on the photo or headline at the top of the page. Again, that's at landlinenow.com. That's our program for today. Thank you very much for joining us. We'll be back tomorrow with more. I'm Mark Reddick, and this is Landline Now.
Thanks for listening. Be sure to like and subscribe. If you want more content, go to landline.media to get updated news, information, and archived editions of our show. Once again, that's landline.media.
I'm a dad,
a son,
a husband,
wife,
I'm a writer,
photographer.
I farm.
I'm a veteran.
I love old cars, fishing,
my kids,
chrome, and I am
a professional truck driver.
And together we are OOIDA.
OOIDA was founded by truckers to stand up and speak on behalf of truckers. We've done that by combining the individual voices of our members into a single, powerful voice. Protecting your interests, defending your rights.
Join us!
Make your voice heard. Join OOIDA, the Owner-Operator Independent Drivers Association. Call 1-800-444-5791 or visit OOIDA.com.